Okay, so today we're here with Rachel, and Rachel would like to have a more defined jawline. Rachel, will you sit up for me? Rachel is young, so she really doesn't have aging of the jawline. She just wants more definition. She feels like it's a little more straight, and she'd like just a little more angle to it. Rachel's one of, in general, 3 types of patients that I see. She's our young patient who does not have signs of aging, but would just like more definition. And the other 2 are either our aging females who have lost bone and definition, and we're creating more structure there, and then also our male patients. And so each of these patients, I assess and treat differently. For Rachel, again, less is more, because she really, she has it. Yes, it is straight. It's not very angular. For female patients, ideally we have about 125 to 130 degree angle, and she's pretty close to that, but just a little straight. She'd like to create a little more definition and structure through here, so that's what we're going to do. Also for Rachel, if you can see, we don't want to assess the jawline in isolation. We want to look at the whole facial structure. So Rachel has beautiful cheekbones. She actually has, again, a nice heart-shaped face, or more of an oval, shaped face. However, when I do, again, come back to her profile, she has a very mildly recessed chin. So I would like to address that either today as I do the jawline, or separately by putting some filler directly there. And also we talked today about putting some neuromodulator in the chin, such as Botox in these mentalis muscles, because she really likes to pull that tight. If we can relax that down, it's just going to create more balance for her. So also when looking, when it comes to doing the jawline, we want to make sure to be safe. So I have palpated for what we call the antegonial notch, which is where the facial artery comes out. So I'm just going to be sure to avoid that today, which isn't a problem. I like to use cannula. There's a lot of different ways that people prefer to inject the jawline. I prefer cannula. Sometimes I'll use a needle back here in the gonial angle, again, primarily in my male patients or for females who really have a lot of bone loss. So today I'm going to use the cannula, and I'll just avoid as far as entering into this area. So any questions?
No.
Okay, wonderful. So I think we'll get started. So we just finished doing Rachel's jawline with Vollux. And so again, beautiful structure. We're just trying to create a little more definition, a little more balance, but maintain her feminine structure and look. So I think we've achieved that. And now though, again, need to give a little more projection here in her chin to create overall balance with these beautiful cheekbones and this jawline, just to continue it on. So now I'm going to use Voluma and just really work on giving her some projection. Are you ready? And that already is so much better. Okay, we can see, and you can turn a little bit, and you can see much more balance between her nose and her chin, the angle of her jaw now. This way, and then turn that way. Yeah, much better. And it'll get better and better over the next couple weeks as everything settles in, heals, integrates into the tissues, and then we'll reassess everything in a couple weeks and see if we need to do anything else. Good?
Sounds good.
You want to take a peek?
Yeah. Oh yeah, I like that.